So we move on to prostate cancer. We've already established that cancer is abnormal proliferation or growth of the cells of a particular part of the body. So prostate cancer is an abnormal proliferation of the cells of the prostate gland, right? So mostly when a patient is having retention, you have to do further tests to know whether it's just a benign prostate hypertrophy or it's cancer of the prostate gland, right? Cancer of the prostate gland is the most common type of cancer in men after lung cancer, right? So it's the most common, it's mostly affects men, and then it's the second only to lung cancer. And then it affects men over the age of 65, right, 55 years. And it's more common in black men. And then cancer of the prostate gland is mostly an adenocarcinomas, right? So it arises from the epithelial cells of the prostate gland. Okay, so let's look at some factors that can increase the risk of a person to this condition. Right, so aging is one of them, which we can't do anything about. And then the race, being an African American, is also one of the risks. And then family history is also one of the things that can, especially when your father or your brother is having this condition. Right? And then smoking, and then taking in fast food that is rich in fat, meats, and then less of fruits and vegetables can also increase your risk to this condition. And then obesity. Obesity is also one of the risk factors. Then physical inactivity. And then some viruses can also increase your risk to the condition. And then exposure to some chemicals and environmental toxins can also increase your risk. The signs and symptoms is not different from the benign prostate enlargement that we talked about. So they have signs like dysuria, urinary retention, hesitancy, urgency, dribbling of urine, hematuria, right? So sometimes they have blood injury, nocturia, frequent urination, we mentioned that. And then with cancer, at the later stage, sometimes they start having pains in the pelvic pain, right? Pain in the bones of the pelvic, right? And then painful ejaculation, etc. Okay, so diagnostic investigations is also the same as the diagnostic investigation for benign prostate hypertrophy, right? With the stages of prostate cancer, we have stage 1, stage 2. So we have T1. T1 refers to cancer of the prostate gland that is too small to be felt through digital rectal examination, right? So T1 means that the cancer is too small, so you can't feel it by doing digital rectal examination. And then most of the time, it is mostly noticed via biopsy, right? So with T1, most of the time you can only notice it through biopsy, and then depending on the size, it will be assigned A, B, C, right? Depending on how the enlargement or the size. And then T2 means that the prostate cancer can be felt during digital rectal examination, right? So the cancer can be felt by palpating it via the rectum. With the treatment, it's mostly surgery, right? The same as benign prostate hypertrophy. So we do prostatectomy, right? Which is the surgical removal of the prostate gland. And apart from that, because it's cancer, radiation therapy and then chemotherapy may also be done, right? So with the prostatectomy, you can have open prostatectomy, you can have laparoscopic prostatectomy. I've mentioned perineal prostatectomy. transurethral prostatectomy. You can have the suprapubic, the retropubic. The suprapubic, retropubic, most of the time is the open prostatectomy, right? And then pre-op operation is similar to the pre-op for somebody going for benign prostate hypertrophy surgery, right? So they are all done via prostatectomy, right? So it's the same. Pre-op is the same. Post-op is the same, right? Post-op management is the same. Okay, patient teaching is also not different from the one we talked about, right? With the radiation therapy, so I said that it can be done through radiation therapy or chemotherapy, right? So as nurses, we have to prepare them for the radiation, and after the radiation, we also prepare them, right? Because we mentioned earlier that the radiation, you have two forms, the brachytherapy and then the teletherapy, the internal radiation and then the external radiation, right? So management is similar to benign prostate hypertrophy. Okay, so we end the lecture on prostate cancer.